My name's Nadim Bikhazi. I'm one of the ear, nose, and throat physicians at the Ogden Clinic. We're affiliated with Ogden Regional Medical Center. Well, the role of an ear, nose, and throat physician is really to deal with patients after a primary care physician has exhausted medical treatment. That's really who we see, are people who have failed medical treatment with antibiotics or decongestants for sinus problems. And so at my clinic, at the Ogden Clinic, I'm affiliated with Ogden Regional Medical Center. We'll see a lot of referrals for people who have failed the standard medical treatment for sinus problems. And so at my clinic, we do a lot of these, what we call minimally invasive surgical procedures. Just top to bottom, we treat ear problems, including hearing loss, wax blockage, fluid in the middle ear, and certainly recurrent ear infections in children. Then you get to the nasal area, has to do with nasal obstruction due to septal deviation or nasal valve collapse. We do its chronic sinus problems. And then in the throat region, chronic tonsillitis. Further down in the neck, thyroid problems or neck masses. So really we cover a wide range of medical specialties in the head and neck. And so one of the ones that we treat is most commonly is sleep disturbance, including snoring and sleep apnea. Realize a lot of obstructive sleep apnea has to do with blockage in the head and neck region, which is where we work. Some of it is nasal, some of it is palate, some of it is at the base of the tongue, and some of it is further down. So we will work in coordination with our neurologists and our sleep doctors to get people fitted well with CPAP, which is a positive pressure mask. Sometimes patients are surgical candidates, and sometimes the problem is more mild, where they may need just mild treatments for snoring and sleep apnea, such as mandibular devices and retainers that prevent the obstruction of air. So really the range of our effect on sleep disturbance and snoring is wide. It can be minimal or it can be major in terms of surgery. It just depends where the problem is. You know, one of the main issues with ear, nose, and throat surgery is being attentive to the exact problem that comes in. So we really try to focus in on why you're there. Sometimes in a primary care office, you've been given great treatment, but a lot of times they're trying to cover a whole range of medical issues, and there's not enough time to focus on the one issue. So I think that's one of our real advantages in the world of ear, nose, and throat, that we really pride ourselves in focusing and taking care of those problems that bother you and your loved ones.